Our next speaker is going to speak about reducing blight in urban areas as a strategy to reduce gun violence. He is Dr. Charles Branas, the Gelman Endowed Professor and Chair in the Department of Epidemiology at the Columbia University Mailman School of Public Health and the Columbia Center for Injury Science and Prevention.
Good morning. It's good to see everyone here. It's a pleasure to be here to come speak with you. So over a decade ago, some of our research teams frankly became a little frustrated by the progress we were having in different cities in terms of reducing violence and gun violence in particular. And we did something that is far too unusual for researchers. We went out to the communities and we asked the communities that were most effective, what is it that you think is generating the violence and the gun violence in your neighborhoods? And we got a number of different answers, ranging from family structures, youth who were committing these violent acts. But the one thing that came up over and over again across all different types of neighborhoods and different people was this recurring theme of the abandonment and the vacancy and the physical dilapidation of their neighborhoods, and that they knew, because they were witnessing it on a day-to-day, that this physical dilapidation and, for lack of a better word, blight in those city neighborhoods was generating the violence. Now, it's been perhaps 60 or 70 years that we've been in this terrible spiral in our cities. And I'm not just talking about our major cities, I'm talking about our mid-sized and our small cities as well in the United States. In this spiral of disinvestment, and by disinvestment I mean that people have pulled investments from cities, but much of it has been a systematic disinvestment with terrible policies such as redlining, systematic pushing people out and into neighborhoods or not permitting people to be in certain neighborhoods. That sort of disinvestment in resources and the capacity to have housing in certain neighborhoods has led to this spiral of crime being committed in those neighborhoods, which has led to people leaving the neighborhoods who can, yeah? And then that whole spiral continues. That abandonment leads to greater disinvestment, which leads to crime, and these cities have spiraled down in the past 50 or 60 years. Some cities have lost nearly half their populations from the 1950s. Cities like Detroit and Philadelphia, which are replete with properties just like this. Abandoned buildings and abandoned vacant land in these cities has grown to epic proportions. So one of the things to consider is what can we do about this? We have these, and what the neighbors told us in these neighborhoods over and over again was, these are the things. They know that the shootings are happening. They know that the city is probably not responding as well as they think to these shootings, but these are the things that they see on a day-to-day when they go walk to work, go to the bus, right? Go to the subway, send their kids to school. This is the surroundings that Dr. Cooper was just talking about that people see on a daily basis, and this begins to erode your health and probably your safety, and I want to talk about that a little bit more now. So this, for those of you who have not visited Europe, this is a map of Switzerland, yeah? With work that we've done and earlier work from the Brookings Institution, if you take this map of Switzerland and you add up all those abandoned spaces in cities around the nation, the space and the square footage and the square mileage of those abandoned spaces adds up to an area the size of Switzerland in the United States. This is a massive challenge. Yeah? But I'm gonna argue to you right now that this is also, it is a major challenge, but as we thought maybe 10, 15 years ago and others are beginning to see, this is also a great opportunity to do something and to have an impact and to make changes on our cities and perhaps on the gun violence in our cities. Now, public health, since we're in a public health, this is sponsored by the American Public Health Association. Public health and epidemiologists are fond of talking about their desire to focus on three things: people, pathogens, meaning diseases themselves, and places. Now, if you talk to, for instance, if you think about people who are trying to prevent malaria, they are going to focus on, well, giving people bed nets, for instance, to not let the mosquitoes in, right? Giving people different sort of anti-malarial drugs to prevent the disease from circulating in their bodies. But it is a classic approach in malaria prevention to also focus on the standing water and the spaces and places that are generating the malaria, the mosquitoes and the malaria in the first place, and to fill them in, yeah? This is no different, frankly, It is an analogous situation with our firearms, yes, and firearm injury, and the people who are affected, and the places. Now, we focus, and we've talked a great deal today about the people and the firearms. We devoted an entire panel to the firearms, and to the credit of this group, we want to find multiple ways, not simply focusing on the firearms, but bringing in other approaches, and unfortunately, we have not focused as much on the places and the surroundings that may be generating and cultivating this firearm violence in the first place. So, very importantly, I want to tell you about a number of the things that our group has done, but also that other groups and cities around the nation have done. Cities like Philadelphia, Newark, Cleveland, Chicago, Detroit, New Orleans. These are cities where a number of different studies have been done, both observational studies, meaning that the folks in the city and their university partners studied what the city implemented in terms of place-based solutions to gun violence, but also there have been now a number of randomized controlled trials, that is, true experiments of these different sorts of treatments to these abandoned and vacant places and spaces, buildings and land in cities. And you get a sense here, I wanted to just show this to you briefly. These experiments run by randomly choosing spaces in cities, perhaps a small percentage of them because we can't afford to do them all in the context of a study, where a city might have perhaps 50, 60,000 such spaces in an inventory of buildings and land in the city and lots. The yellow on the left side of that slide is, the red is the chosen lot, the yellow are all the other abandoned lots in that particular space. So you get a sense of some blocks and some streets people are living with perhaps half the buildings or half the spaces in their neighborhood are this way, or like the pictures I just showed you. Again, very difficult to step out and see that on a day-to-day basis. So what did these randomized controlled trials tell us? Well, I'm going to tell you about the findings for some of the greening, that is the vacant lot greening studies that we've done, and some of the abandoned building studies that we've done, where you take spaces that look like the spaces on your left and you move to the right through very simple and inexpensive processes, yeah? And these are processes, by the way, that originated, the recipe for this, the cookbook for this originated with single neighborhoods and single cities where some motivated residents said, we're just going to do this. We're going to try it on a couple of these. And many cities have now scaled this up because it's very inexpensive and quite scalable. And what they're finding, if you go from left to right here, is across a variety of studies, whether it be greening, fixing the buildings. We have a great new lighting experiment that's just come out in New York City, or planting trees. Some of the earliest work was planting trees in the city of Chicago. These studies have generated and have shown across them anywhere from 6 to 56% less gun violence. But not just gun violence when you treat these sorts of things, also vandalism and other sorts of crimes are affected by this. And very importantly, we have teamed up with a number of different economists to look at what a city would get back. What do taxpayers, what does the society and the communities in that city get back? So for every dollar invested in these programs, because they are so inexpensive to green lots and to treat abandoned buildings, to remediate abandoned buildings, and because gun violence is so expensive, okay? The trade-off here is for every dollar in, there are hundreds of dollars returned to the taxpayers and to the neighborhoods of that city. So the return on investment here is quite high, quite effective and quite high. And we think of this as a form of what we're calling win-win science. So this is the opportunity for scientists to actually not just generate knowledge and new thinking about what can be done about something like gun violence, a prime public health crisis, but it also brings resources to those neighborhoods. The studies that have already been done have changed thousands of different buildings and vacant lots in cities across the nation just by doing the research itself in an effort to study it. So things like gun violence go down, yeah, you can see that on the left, but also things like nuisance crimes and vandalism, public drunkenness, these sorts of things also go down quite a bit. But then people go outside more is one of the things we find as part of this. And not only does the violence that is reported to police and reported and recorded by police go down, but neighbors feel safer. They're also self-reporting that the crime went down and the gun violence went down in their neighborhoods. So briefly, how does it work? Well, the primary way that this works is because these spaces, the abandoned buildings and the abandoned lots, and right next to the spaces, perhaps abandoned cars that are put purposely near those spaces, are opportunities for the storage of illegal firearms. So the police will call these, frankly, storage lockers for illegal guns. If you remove the storage lockers, you're having an impact on the means of the violence itself, which is one way we think it happens. The other way we think that the reduction occurs is because neighbors have been living with these, as I said, for decades, these sorts of spaces. Once you clean and green or get a building fixed up, neighbors do not want it to return to the way it was. So they will go out of their way to informally police that space on a day-to-day basis. They do not want someone perhaps selling drugs in front of that space or doing anything with a firearm in front of that space, so they will move that person off the space and ask them not to do it. And in the end, this does not move crime around the corner. It actually reduces the commission of these acts. And then the last way is because neighbors are coming outside more, they're able to connect with one another and share information to a greater degree. So the recommendations that I have at the end of this, coming out of it, is that we really do need to infuse and include these sorts of population-wide and place-based interventions, which, as I was showing with the malaria example, these interventions, if we use them for gun violence, we would be standing on the shoulders of many other public health interventions that preceded these. Whether it be for infectious diseases like malaria, it could be the purification of drinking water, the chlorination of our water systems, it could be removing lead poisoning from buildings. This is built on the backs of that kind of work, but focused on the reduction of gun violence. So we're in good company. And then gun violence interventions to change these blighted and abandoned spaces are, I have to say, they're well studied at the highest level of science. So we do have not just observational studies, but we have a series of citywide experiments that have been done to demonstrate that these work. So they are effective. They are inexpensive, very important to understand. This is not building the High Line in New York City. Yeah? So these are inexpensive, singular introductions and placements in neighborhoods that are distributed. One reporter called these building the park of 1,000 pieces in a city. They are distributed and they are designed not to have people move out of their neighborhoods, but to give people opportunities for parks and not dilapidated spaces right next to their homes. They don't need to go anywhere and they get to stay in their neighborhood. They are, again, because they're expensive, they're scalable citywide for a very relatively low amount of money compared to other. And finally, they're apolitical. This is not taking firearms out of the hands of any legal owners. This is just opportunities to impact the illegal storage and movement and misusage of illegal firearms in cities. And then finally, I'll have a pitch to say that I would like to see city and state legislators, but also federal policymakers, to begin to invest in, as a first step for a city to do this sort of thing, a city must have an anti-blight ordinance. You'd be surprised how many cities do not or have an impotent anti-blight ordinance. And so we need that legislation to be in place for many cities, but then we also need to, again, direct the resources to this kind of reduction in dilapidated and abandoned spaces across cities in the U.S. And the return on the investment could be quite high to do this. And I think that's it. Thank you very much for your time.